Hi, my name is Rachel, and today we're going to bust some myths about therapy. Okay. Therapy is only for those with a diagnosable condition or recent trauma. So this is probably one of the biggest barriers for people to get therapy, and the reason I think it's so misunderstood is because you often think you need to have a condition like, I don't know, depression or anxiety or ADHD to go and see somebody, but actually therapy works its best when it's preventative rather than just treatment based. So when you're feeling a little bit down or a little bit low, you have a little bit of stress at work or with your family or social issues, going to therapy can actually help prevent those conditions from getting worse, but also give you the tools to manage them so that later down the line you don't actually have to go back to therapy. So my suggestion is preventative is always better than trying to manage symptoms once they've already happened. Ready? Ooh, that was easy. Therapy is the same as talking to a loved one. Okay, this one is super common, and I think, yes, of course, talking to a loved one, whether it's like your best friend or a sibling or a parent, you can get great support, and by all means, I think that support should always be there. But therapy with a therapist is someone who doesn't know you, and you're probably more likely to be honest with them because there's probably things you don't want to share with your best friend or your parents. The other thing that therapy can provide you with is accountability. So your friends aren't probably going to tell you when, maybe you shouldn't have done that, or maybe there's a different way of approaching it. So a therapist will be able to balance that really well between validation and accountability, whilst also giving you that sense of comfort to share things, your vulnerabilities that maybe you don't really want to share with your loved ones. Yeah. The other thing is there's only so much that we can offload on our friends before it becomes too much for them. And also sometimes we don't really know what our loved ones are going through. And so potentially our stuff can add more stress to them, which is obviously not necessarily our intention. So speaking to someone who's trained to handle those things is best. Yeah. We peel this one. I don't think this one will be that easy. Oh my gosh. Okay. Therapy is for life. So I actually tell my patients the exact opposite of this during our intake so that they have a better idea of what to expect with the process of therapy. A therapist should really be working with you on identifying what your problem areas are, what you're struggling with, whether it's anxious thoughts or unhealthy coping mechanisms or a recent breakup, for example. So your therapist should be working with you to give you the tools and skills to manage all of those things, giving you guidance and practice along the way with the support, in hopes of eventually getting you to a place where actually you don't need to come in anymore because you've got the skills to deal with it, whether something happens today or next month or in a year. So ideally we maybe start off quite frequent, maybe once a week to gain those skills, build up that rapport, and then once we see progress we might taper off to once every 2 weeks, then perhaps once a month, and then occasionally if I need to. And I think if you feel like perhaps your therapy is taking longer than expected, that might be a good time to check in with your therapist and say, hey, are we really moving towards where we want? Are there goals that we've set? Is there a different path that we can take? Perhaps A, B, C, they're not working. So having that open line of communication with your therapist is best. But yes, therapy is most definitely not for life. Okay. Children are too young for therapy. So this is actually a super common concern, and I can understand why, and it is obviously symptom dependent, but ultimately I think it's really important that parents remember that you know your child best, trust your gut, you're going to be able to notice any differences, whether it's social, emotional, or behavioral, and preventative care is always best. But even if perhaps, let's say you are concerned that you've worried too far ahead and you can go and see a therapist, the therapist will always be able to tell you whether something is actually developmentally appropriate or perhaps maybe we have something here that we need to work on. So if you do have concerns, trust your gut as a parent, go and see somebody, and they're going to be able to advise you best. But therapy for children is always really great, and there's great therapy out there that's tailored for kids specifically. Yeah. Therapy will always lead to medication. So I really love this one because it's one of the myths that I really enjoy busting, because it is a huge barrier for people to get therapy, and especially I think parents sometimes think that medication is going to happen, so they don't suggest therapy for their kids. But therapy will definitely not lead to medication. Medication will be very much case by case and symptom dependent. Your therapist will get to know you first, your symptoms, what's going on, before they even consider medication for you. Sometimes medication can be suggested by a therapist if they feel that maybe some of the physiological experiences or sensations with anxiety or depression are so overwhelming that it actually stops you from successfully accessing those therapeutic skills that you're learning. So in those cases, they might suggest you go and see a psychiatrist and see if you need medication so that you can get to a place where you can easily access those tools. But again, it's case dependent, so perhaps ADHD, depression, anxiety, anyone who might be self-harming, things like that. But again, it is a personal preference. So you might get a referral to see a psychiatrist, get a diagnosis, or get a suggestion for medication, but that still doesn't necessarily mean you're going to walk away on medication. So it is ultimately your decision and your choice. You ready? All therapy is the same. I think this is probably one of the biggest reasons people don't go back into therapy if they haven't had the best experience, because they assume, well, it was like this that first time, so it's going to be like this the second time. There are so many different types of therapeutic modalities and approaches, and depending on your presentation or your symptoms, you might be more inclined to one or the other, or your preference in approach or communication style. So there are so many modalities out there, and even within modality, I would say there are different types of therapists, different ways of communicating, and just different vibes. You might find that there's a therapist that you were able to connect with better and have better rapport. That doesn't mean that the other therapist wasn't good at their job. It just means it's dependent on, the preferences you have for personality or communication. So all therapy is most definitely not the same. And if you feel like you've had not the best start, then that can be quite discouraging. But I would say please don't give up. Maybe do a little bit of research, figure out what it is that you didn't like or liked about that first session, and follow down that path until you find the right one. Okay, that is 6 myths busted about therapy, and hopefully we've all learned something new, and that can help us bring more awareness into mental health and destigmatize therapy, not just for you, but maybe other people in need. So thank you for watching.